All right. Firstly, a very good morning to all of you here. It's great to see so many of you joining here on this Charcha from across India and Africa. So I'm just going to take a moment to thank you for being here. Uh, Welcome to Charcha on exploring Africa's digital and public health system. This Charcha is extremely special for us because we have, for the first time, members of our Youth Africa community who will be leading this webinar. So we have Kahinde, Isaac, Abdullahi, and Lizzie here on call with us. Your Charcha are our monthly webinar series. As you know, Yod is a community of digital health professionals under 35 from across the world. In case you're not a member, please feel free to register and join us in our wonderful community. Before we begin the webinar officially, we at Yod have this rite of passage. We have something called as a chat waterfall. So I'm going to request everyone to go on to chat and type in your names, your organizations, and your designations, but just don't press enter yet. I'm going to give you all a cue, and then every one of us can press enter. So let's just take 30 seconds to write those down. Great. Can take 10 more seconds, and I think then all of us can unanimously hit enter. All right, on the count of 3, 2, 1, everyone please hit enter. Great. Oh God, lovely. Hi Pallavi, hi Saloni, hi Dr. Saima, hi Anuradha, hi Kahinde, hi Abdullahi, hi Sahil, hi Isaac, hi Dr. Jaydeep, Lizzie, Shiv, and Nazia. Incredibly amazing to have all of you here, and I'm now going to pass over the mic to our presenters. I'm going to request the presenters to firstly brief themselves, give a small introduction about themselves, and then I think we can begin with the webinar, with the presentation, my bad. And in case you have any doubts, you have any questions, please feel free to put them on chat. We will be having a 10-minute question and answer section at the end of the presentation where our speakers will be able to take up your questions. So I am now going to hand over the mic to them. All over to you, team.
Thank you, Sarah. My name is Isaac Ngugi. I'm from Nairobi, Kenya. I'm a data analyst intern at Presta Capital, and I'm also a rights and education activist at Their World. So I'm really happy to be here.
Lizzie, would you like to go next? You're on mute, Lizzie.
Sorry. Okay. Hi guys, I am Liz Mbogwa from Kenya. I'm a student at Catholic University pursuing nursing. Yeah, and I'm happy to be here. Thank you.
Thank you, Lizzie. Kahinde?
Hi everyone, good morning. My name is Kendi Moreno, and I work with Charcha as a senior analyst. I'm based in Lagos, Nigeria. Pleasure to be here. Thank you.
Thank you, Kahinde. Oh, go ahead.
No, I'll pass it on to Abdullah.
Okay. Abdullahi?
Yes, hello everyone. Good morning. My name is Abdullah S. Abdurrahim. I'm a student at University of Lagos. I'm also a research assistant at Department of Pharmacy. Thank you.
Thank you, Abdullahi. I think we can now begin with the presentation. Kahinde, would you like to share your screen?
Can you see my screen right now? Is it better?
Yeah,
Yes.
I can see your screen.
All right, thank you.
To the audience, in case you may have questions during the webinar, please feel free to put them on chat and we'll take them at the end of the session. Thanks.
Okay, thank you. So welcome to YO.DH Charcha, presented by Africa. It's exploring Africa's public and digital health system, and the presentation was created by Lucy, Kahinde, and Abdullah. Sorry. Okay, the objective is to provide an overview of healthcare systems across Africa, with emphasis on their structure and evolution in Kenya and Nigeria, to compare like the healthcare delivery and payment systems between Nigeria and Kenya, to identify major healthcare challenges facing African nations, analyze the role of digital health technology in transforming African healthcare system, highlight opportunities for youth involvement in digital health innovation and ownership, and also to present case studies of successful digital health implementation in Africa. Next slide. So the image represents healthcare evolution in Africa, as it has rapidly grown due to youth population. And historically, medical systems were shaped by colonial models. This include like military and settler healthcare, missionary healthcare, extractive industry healthcare, epidemic control campaigns, and even segregated healthcare, which prioritized certain groups over broader public access. Today, nations are working towards universal health coverage, but funding gaps continue to restrict equitable healthcare accessibility. While life expectancy has improved, the continent faces a dual burden of rising chronic diseases along persistent infectious threats. Okay, you can see accelerating digital health adoption in Africa. Despite the obstacles, digital health dimensions that will be healthcare delivery and also healthcare payment and financing. Next slide. Next slide. So we are going to be looking at Kenya and also Nigeria. So in Kenya, imagine a mother in rural Kenya walking miles to the nearest dispensary with her sick child. The facility has limited supplies and she's forced to like travel further to a primary hospital for better care in urban areas. And also imagine a father who is in an urban area who finds himself stuck between expensive private healthcare and overcrowded public hospitals. So these struggles are real because of the increasing population in Kenya that is expected to be like 83.6 million by 2050. So it's putting a lot of pressure on healthcare facilities. Next slide. So there are 6 levels of healthcare in Kenya. So we usually begin with the community health workers. This was just provide preventive care, health education, and screening for like diseases like malaria. And then we have level 2, that is dispensaries and clinics. These are just offer basic outpatient services. We have level 3, which is healthcare centers and maternity homes. We have level 4. This is now the county hospitals that provide like general surgeries, emergency cares. And then we have level 5, the county referral hospitals that cater to complex conditions like cancer treatments. And then we have level 6, the national referral hospitals, such as Kenya National Hospitals, and that handle organ transplants. Next slide. So, so we have healthcare delivery in Kenya. This includes 4 models: the government-funded schemes, the community-based health insurance, we have the private insurance, and also we have the microfinance schemes. So the government funded schemes, such as Social Health Authority, that changed from National Health Insurance Fund. We have the Taifa Care Initiative. In the community-based health insurance, these ones are usually just low-cost models for like informal workers who can't like afford the government-funded ones. And then we have the private insurance plan. These ones are the ones usually like cover employees and also like self-employed individuals. And then we have the micro insurance schemes that are affordable plans for low-income groups. Next slide. Lizzie.
Lizzie?
Okay. I'm going to take you through the current landscape of healthcare funding and payment, focusing on how different mechanisms contribute to the overall picture of the healthcare system in Kenya. So this slide breaks down the primary sources of healthcare funding and how they impact access in Kenya. So we have 3 types of funding models in Kenya. We have the government funding, which accounts for 45%. And this is the largest portion of funding. And it highlights the significance of the government in the healthcare system, since there is the Social Health Authority, or the SHA, which is now replacing the NHIF, or the National Health Insurance Fund. So as an outcome or an advantage, the primary healthcare services are now fully tax funded. So this means a reduction in out-of-pocket costs for many Kenyans. But however, that is not the case for most hospitals, because you will find that most Kenyans, approximately 75%, lack insurance and end up using out-of-pocket payments. So that is the downside of that. Most Kenyans don't have the insurance. And then the second one is the private insurance, which accounts for 17%. And with this type of insurance, employer-sponsored plans are the dominant form of private insurance coverage. So this actually means that a large portion of those with private insurance get it through their workplace. However, the private insurance is not largely used because of the high premiums, which is a major challenge. Many individuals and families they cannot afford the cost of private insurance. And also the second disadvantage is they have complex policies that can be difficult to understand for some people. Thus, it is not widely used. And we have the third one, which is the out-of-pocket payments, which is 38%. This is a very high figure because despite the government's effort to implement the Social Health Authority, or SHA, we find that 9 out of 10 Kenyans still pay for medical expenses directly out of their own pockets. So this is sad because it pushes families to poverty, and it limits healthcare access to most individuals, especially those in low-income households. And then we have most people also delay necessary medical treatment because they cannot afford it, thus leading to worse health outcomes. So this clearly paints a picture of the ongoing challenges that Kenya is facing as it tries to provide accessible healthcare, even with the best intentions of government funding. Yeah, next slide. Okay, we have already discussed a little bit on the out-of-pocket payments. So now we are going to delve deeper into why these payments are so high and know the role of traditional medicine. So the diagram on the left, the one that is on top, it represents the cycle where an individual seeks care, faces high costs, often pays out of pocket, which can lead to debt and eventually long-term negative effects on their well-being. So we need to understand some of the drivers that lead to high out-of-pocket payments. These are limited insurance coverage, because we have said that only 25% of Kenyans have health insurance, and this leaves about 75% of families completely unprotected against medical expenses. So this makes them highly vulnerable to go through a financial crisis in case of any medical emergency. Yeah. Then you have the second one, which is the private healthcare costs. Private hospitals are more expensive and they charge up to 5 times more than public hospitals, making specialized care unaffordable for most people. So this forces many to rely on public facilities, which can be overcrowded or simply delay care, worsening their health. Actually know of a person who went through the private healthcare crisis because the man was to undergo a stent placement. Yeah, because the stent placement, and now he went to a private hospital, but the insurance did not cover the costs, because the insurance said that the cost is very high and it cannot cover the costs. So this led to the person paying out of pocket. And that was really bad because the family as a whole went through a financial crisis. They were not able to maybe stand on their feet again after the procedure. That was a really bad experience. And yeah, that is what is actually happening with the private healthcare and the insurances. Yeah, so that was a really sad story. And then we have the third one, which is delayed government payments, where even when the government funding is in place, there are challenges because hospitals frequently struggle with delayed reimbursement from the Social Health Authority. Actually, I was telling myself with the guy that underwent the procedure, maybe if the government released the funds before, like earlier, the person will have been paid, the bills will have been paid by insurance. But because the hospitals, especially private hospitals, fear insurance because insurance, it's not guaranteed. There could be delayment and you'll have bills, the bills will accumulate, so they don't love insurance. So this forces them to often demand upfront payments from patients, even for insured services, thus worsening out-of-pocket payments, hence placing an immediate burden on the individual. Yeah. So then we have the fourth one, which is high medication costs. So the cost of medicine is another challenge because they have risen by 30% since 2023. And many patients are now forced to skip necessary tests or delayed treatment because they can't afford the medications. The prices have really gone up. Like after the procedure, you are also supposed to be given medicine, anticoagulants, but now the person, unfortunately, he passed away because the expenses were a lot, because you also have to continue with medications after the procedure to prevent the recurrence of the disease. But yeah, it was a lot for the family. So, and then you have the fifth one, which is hospital debt and patient detention. Some hospitals detain patients who cannot pay their bills. This practice worsens financial hardship for families, often leading to more debt and stress. That is true. And then now we are going to look at the traditional versus modern medicine. So the diagram below at the bottom shows a choice that many face, which is a dilemma between, no, the previous slide. Yeah, that one. Which is a dilemma between modern medicine and traditional medicine. And due to the drivers that you have discussed above, 80% of rural populations rely heavily on traditional herbal medicines. And this reliance is often a matter of necessity due to affordability and accessibility issues with modern healthcare. So the Traditional and Alternative Health Practitioners Bill aims to regulate traditional practices, and the goal is to combine both traditional and modern medicine so as to aid in affordability and effectiveness, creating a more accessible healthcare approach. Yeah, so next slide. Yeah, okay, so here we are going to look deeper into the Kenya's healthcare system and its programs. So the Kenya's healthcare system is managed at both national and county levels. And unlike India, where health is a state subject, Kenya's national government oversees major health policies, while county governments handle local healthcare services. And this decentralized system allows counties to address regional health needs, but funding and resource distribution is inadequate. Yeah, the counties don't have enough resources for them to deliver healthcare effectively. Then Kenya has the national health programs targeting different diseases, such as the National HIV, AIDS, and STI Control Program, known as NASCOP, which manages HIV prevention, treatment, and awareness. We also have the National Tuberculosis, Leprosy, and Lung Disease Program, which is the NTLDP, and it focuses on TB control and respiratory diseases. We also have the National Malaria Control Program, NMCP, which works to reduce malaria cases through prevention and treatment. There is also the neglected tropical diseases NTD program, which addresses diseases like yellow fever and bilharzia. There is the maternal, newborn, child, and adolescent health MNCAH program, which tries to improve maternal and child health services. And we have the mental health and substance abuse program, which supports mental health awareness and addiction recovery. We have the non-communicable diseases program, NCD, which covers diabetes, hypertension, and cancer prevention. And Kenya National Public Health Institute, KNPHI, which is focused on strengthening disease surveillance and emergency response. So despite challenges like low funding and accessibility gaps, Kenya is trying to use technology to improve healthcare, and digital health solutions such as telemedicine and mobile payments are helping expand medical services, especially in rural areas. I'm now going to invite Isaac to take you through the next part. Thank you.
Okay, thank you, Lizzie. Okay, so we've talked about public health in Kenya. So let's just look at the digital health. So so these are the impacts in digital health, mostly in healthcare delivery and also healthcare payments. So in healthcare delivery, we have electronic health records that are used to manage data, reducing paperwork and errors, mostly in public hospitals where they usually get more than 700, people per day. We have telemedicines that allows patients in remote areas to consult doctors online and also improves access to medical care. In healthcare payments, we have mobile money platforms like M-Pesa that has made it easier for people to pay hospital bills and insurance premiums. So imagine long time ago, before M-Pesa, if you're hospitalized, your relative had to go and I don't know where, withdraw money from a bank, place it inside a letter, and then send it via PO box, or just give some tourist person. We usually call them matatus. So we have like matatus, and those people will just take it. So you are never ever assured that money will reach there. So M-Pesa has made us to like reduce cash transactions, even making payments safer and even more convenient. So the impact of digital health is significant in Kenya. Patients receive fast and more efficient care, hospitals have improved data management, and even mobile payments make healthcare more affordable. So despite challenges like low funding and even internet access, Kenya is moving towards a more connected and even accessible healthcare system. Thank you.
All right. Thank you so much, Isaac. Good morning, everyone, once again. So what I'll be doing right now is just walk us through Nigeria's digital health landscape, highlighting the challenges that we face, but more importantly, the opportunities that exist, that's leveraging digital health as a means to strengthen the health system in Nigeria. For context, Nigeria, as we know, has over 250 million, population, and we have a very diverse economy. At the last count, our GDP is at 2.5 trillion US dollars. What this means is that we have a very good ecosystem that thrives economically. However, this has not really translated into our health indices. So at the moment, life expectancy is pretty low. And what it means is that at the end of the day, we'll see our population reaching the age of retirement because it sits at 52.8%. MMR is still very much low, as much as our fertility rate. And what this means again is that women are giving birth and we have more population, but then the health system is not there to really support this growing population in Nigeria. So I'll just lay over what Nigeria's health system is in terms of the structure. So we typically operate a 3-level structure. The very basal level is the primary healthcare structure, which sees the normal things that we typically would go to a hospital for. Things like antenatal for pregnant women, immunization for kids, malaria testing, and all the basic things. And it's quite affordable and inexpensive. And so people will naturally go to this place, and it's closer to the grassroots or the local government level in the country. And then when we see the need for more advanced levels of care, we escalate through referrals. And this is done at the secondary level, where we have general hospitals taking over this type of care. And so this handles referral cases, more specialized levels of care than the primary healthcare structure. And then if there's any need for more complex, more specialized care that the secondary healthcare level cannot handle, it's now taken to the tertiary healthcare. Now, for the tertiary healthcare, this is more affiliated with universities or advanced educational centers, because they support with policy formulations and regulatory formulations as well. And so if you come to Nigeria, what you would keep on hearing, if you're thinking about tertiary healthcare, you will hear teaching hospitals or federal medical centers. And that's the structure that we operate as mandated by our constitution. Just giving you a broader perspective regarding our healthcare. We still have a large burden of disease that we try to solve on a daily basis. So in terms of infectious disease, still pretty much large, still high. And this again speaks to the financing of the health system, the infrastructure that exists, but more importantly, the health-seeking behavior of Nigerians, where there's this distrust with the system, and we don't really go to the clinical side or the medical centers for our care, we leverage the traditional approach, which again, as you know, affects the quality of care and the outcomes that we see. As if you go to my left, you'll see that our indices are still pretty much not where it should be. And this is just an offshoot of all of the factors that affects the high burden rates that we have in country. In terms of our funding landscape, it is done on a three-level approach. The government finances a part, although there's a declaration that says government should actually devote 10% or even more to its health priorities. But this is something that we so struggle on a yearly basis to achieve as a government. And this is where the private sector steps in to bridge this gap, where more than 70% of our funding in terms of health priorities is brought by the private sector. For vulnerable groups of people, those people that cannot afford to pay, the insurance in Nigeria takes care of these people through the Basic Healthcare Provision Fund by the National Health Insurance Authorities. So this is what our structure is like in Nigeria. Just to touch on our challenges and the gaps, like I rightly mentioned, we still have low allocation for budget to health priorities, and this again affects the infrastructural deficits that we typically see. So we should have very good hospitals, consumables and facilities, no stock out rate, but we still have these challenges. In terms of our HRH, which is the Human Resource for Health, most of our very skilled healthcare workers, because of the condition of training and also working in Nigeria, they seek better opportunities, and that has reduced the amount of qualified and skilled healthcare workers that we have in Nigeria. In terms of our health information system, it's very fragmented. So we see many people doing quality things across the country in terms of our health information, but it's not really harmonized. And so one of the biggest challenges or biggest ways we try to solve this is how can we harmonize all the data systems, all the infrastructure that exists into one common place such that it can really help to improve our health system moving forward. So these are the challenges that we have. And just to speak on some of the challenges that we do see across the different levels, but more importantly, how the private sector comes into play, because we have a very good private and public sector engagement in the country. Still, our private healthcare takes the largest cake in terms of the large numbers of healthcare facilities that we have in the country, and the remaining 15% is taken by second and tertiary. However, we still see challenges in these spaces. And then the private sector comes in to support on a PPP level, where they have MOU signed with the government to bring funding investment into the country to solve all of our priorities over a long period of time, where they can also recoup their funding and their investments per time. Just to highlight, so what are the opportunities that really exist? I'll talk on three levels. The first is that we do have very good political will. We have policies in place that lays that structure for us to keep on doing the good work that is expected. Just to highlight that the BHCPF, the Basic Healthcare Provision Fund, is that 1% that the government gives to different states such that they can augment the deficits that exist within the different health structure. So 1% of their revenues, the profit is being sent to different states to take up things like, consumable procurement, things like maintenance across facilities, and that has been really instrumental towards some of the gains that we've gotten over the years. Just to mention again that we currently have what we call the SWAP, the sector-wide approach in Nigeria, where government is saying, for donors that are bringing funding into the country, we don't want you to think about how you want to spend. We would give you the guidance regarding spending this money. So we give you a large basket of that you put your funding in, and as a country, we determine where this funding should go, because we know the priorities that hits deep for us, and that's how we have very good political will right now and policy. Just to touch on the one other aspect again, which is the digital health system. We know tech has the greatest impact of improving infrastructure and even systems. And one thing that Nigeria is leveraging right now is that tech buzz, because we know that we have so much opportunities to leverage on. One of the things I'd like to touch on, which is we have a vibrant young population, and this young population can really jump on the tech train. The second is that we have good internet penetration as well, and this really helps us to leverage tech. Just to mention that during COVID, Nigeria, we took up that leadership within the African space, where we were able to leverage tech for surveillance, for more information for health, and that really helped with flattening the curve. As the curve came in, we kept on leveraging those technology and access to improve the way Nigeria responded to that. In terms of the opportunities that even exist with digital health, surveillance is one key one. But I would like to just speak on access and even the cost. In our rural settlements or communities, one thing that we've really struggled with is that access. And with tech, with digital health, it bridges that long distance. So instead of someone having to walk into a hospital to access care, they can actually leverage platforms to engage with different healthcare professionals and access care as they should. I just touched on this briefly, which is the current landscape. We have a very growing market. We've taken great lessons from COVID-19 to strengthen our digital health adoption. We've seen the impact of what it can be. And then we have a very vibrant ecosystem for investment. And that's why we have very good private and public sector engagement. Again, we still have challenges that we need to resolve, but I think that moving forward, there's an opportunity to scale infrastructural deficits, digital literacy, leveraging technology. This is just a case study of what a typical Nigerian would face, and this is for a pregnant woman, where we have our MMRs very high, because of various factors. So one of the key factors is that the access to skilled care is not there. We have our healthcare workers living the shores. We also have infrastructural deficits. Financing is a problem. But then what are the opportunities that we can leverage digital health? So just to touch on that, with the use of telemedicine, we can always teach our pregnant women on several things, on danger signs, on how to care for themselves during their pregnancies. And this is just one of the various approaches that can be leveraged using digital health. Again, for supply chain, we can always use this tool to strengthen end-to-end last mile distribution of commodities. So instead of having to wait long term, we have Zipline, for instance, in Africa and also in Nigeria, where for far-to-reach remote areas, you can use drone technology to deliver consumables that are for life-threatening cases at a very short amount of time. And this just tells us that it's very possible to bridge all of the challenges that we do have in Nigeria, leveraging technology and innovation. At this point, I'll pass it on to Abdullah, who will just take us through the current status of digital health in Africa, leveraging case studies from Nigeria, Kenya, and other countries. Over to you, Abdullah.
Yes, thank you, Kande, for that. Thank you, Isaac and Lizzie, for the wonderful presentation. So I will move, please, next slide. Kande, please, next slide. So, yes, good morning, everyone, once again. So I'll be talking about the Global Digital Health Monitor. So this is the data that was gotten from Global Digital Health Monitor, that is the world map. So we're talking about 4 different countries. That is USA, India, Kenya, and Nigeria. This table provides a comprehensive overview of the digital health landscape across those countries. It evaluates the countries based on severity. Each scores, we scale it from 1 to 5, and NA means don't have available data on that. So we talk about like 7 different parameters. So the first parameter is overall digital health phase. So for overall digital health phase, USA have 5. That means they are most advanced in digital health space. They are advanced in digital health, while India and Kenya have 4, which means they are moderately advanced, which means they still have space to go. That is India and Kenya. While for Nigeria, they are at the early stage of digital health for Nigeria. While for leadership, and government governance, USA are at 5, which means they have a strong leadership, while India and Kenya 4, which means they have a decent leadership, but still have some potholes to fill. So while for strategy and investment, not find the data for USA. While for India have 5, which means they are high strategic focus and they have a good investment strategy. While for Nigeria and Kenya, limited strategy, they have a good one, but there are still some potholes to fill. While for legislation, policy, and compliance, for USA and India, they have 5. They have 5, which means they are well established in their legal framework for USA and India. While for Kenya, is good, but they still need some strengthening. While for Nigeria, the policy are still under development. We have our own policy, but it's still underdeveloped. We're still working on it. So let's talk about the workforce. For the workforce, for USA and for India, we don't have the data. While for Kenya and Nigeria, there is still significant workforce, because from my own knowledge, for Nigeria, the health workforce is not that great. According to what Kende said, he talk about your youth that they have energy in tech, but still we don't have that funding, that funding or that encouragement that will give our youth to work on it. Many youth have their own skills, they want to develop something that will help the community, but they don't have the funding, they don't have the support they need from the government. So for the workforce, we are like 2. So for standard and interoperability, for USA, we don't have data, while for India are on 4, which means they are good, but still have some potholes. While for Nigeria, we are 3, which means we need improvements. For infrastructure, USA are at 5, that means they are highly developed in digital infrastructure. For India and Nigeria, which are 3, moderate infrastructure, while for Kenya, they are better than Nigeria and India, but still, they are behind USA and they still need some puzzle to fill up. So we talk about, we also have service and application. For service and application, data, while for Kenya, they are at 4, which means they have good availability of digital health services. While for Nigeria, they have limited service, which means they still have some potholes to fill. So what is the summary of all these digital health monitoring maps? This map was gotten from the Global Digital Health Monitor, which we call the World Map. So from the summary of this, we notice that the USA lead in most category, but they lack data in some. Most of their category, overall digital health, leadership, legislator, USA lead, but some of the data are not available. For India perform well in some aspect, and for some aspects that somehow lacking, but still they are still leading in this global data monitor. While for Kenya and Nigeria, we are moving in same space with Kenya and Nigeria. Next slide, please. So what are the impact of digital health innovation in Africa? So this is a summary of the impact of digital health innovation in Africa. We all know that digital health emerged during the COVID-19 era. That's when digital health become important. People are trying to develop You are trying to make people's life easy. So what are the positive impact of this digital health? Number one, expanded healthcare service. Telemedicine help patients in remote areas for consult specialists, cutting travel costs to up to like 40%. Digital health innovation help to cut travel costs to up to 40%. That means you don't have to travel far away to go and meet a specialist. At your own house, you can like you can if you can access a telemedicine, you can access a specialist to to consult you. Also, improve diagnosis and efficiency. Using AI power to reduce misdiagnosed rate by 30% and streamline healthcare management. Uh, introduction of with digital health, misdiagnosis was reduced by 30% in Africa, which is a very, very long something to have. Like misdiagnosed in Nigeria in Africa was reduced by 30%. We also have financial protection, healthcare costs and speed up reimbursement. Also, we have data-driven solution. Digital health tool improve the disease tracking, epidemic response, and healthcare planning. Youth empowerment. Digital health sector has created almost 100,000 jobs for youth in Africa. So what are the negative impact of this digital health innovation? The first one is urban-rural divide. So we know there is digital health innovation, but the access is mostly for the rural area. The urban area does not have access to digital health. The access to digital health solution is 76% lower in rural area. That means it's only the urban area that have more access to digital health. Privacy concern. Because of our weak data, one of the issue of digital health is data collection. To have a good data, like a data you can rely on. So in Africa, we have weak data protection, which can be vulnerable to cybersecurity threats. So we also have over reliance on funding. It's one of our most important like fallback, like our positive impact. Everyone that is trying to do something like innovation, trying to do a startup, always rely on government for funding or donors. So anytime the donors did not like comes to the startup or the idea which I so over reliance on funding. Many digital health startups fail when donors stop supporting them, making sustainability very, very difficult. We also have some regulation issues. Many unverified health have provide questionable medical advice because of the everybody want to like build something. Everybody want to like have a startup. So not every application or every startup was verified before they start working. So there's issue of regulation. And also to balancing technology and human care. Over automation could reduce human touch in medical service, affecting treatment quality. So because of we are trying to innovate technology, so over automation, when we are trying to automate everything, we are trying to automate our application, trying to automate our treatment, our medication, so it can affect the human touch. And we know the human touch is very important when it comes to human health. And we know not have that human touch. So balancing technology and human touch is very, very important in digital health. I think this is the end of this presentation. Thank you all for listening.
Thank you
Thank you,
so much,
Abdullahi.
Abdullahi.
Okay, so we just presented about digital health and also public health in Africa. Looked at healthcare delivery and payments. And let's just be real. Africans can send money across the world in seconds, but still work hours just to find medicine or see a doctor. So how many children must be orphaned because of poor insurance, lack of access, or even missing data that could have predicted disease outbreaks? It's time for the same energy we take in texting into saving lives, because digital health isn't just cool tech or another investment opportunity. It's a key to 3 Fs: fair, fast, and even future-ready healthcare of everyone. Yeah.
Absolutely. Thank you so much, Isaac. And also thank you so much, Lizzie and Abdullah. I think at this point, we welcome questions, feedback, comments regarding the presentation. I can see in the chat, someone has dropped a question, and it goes like this. Is there a national digital health strategy or policy in place in either Kenya or Nigeria? The answer is yes, we do have. Although we need to update the current policy and strategy that we do have in Nigeria, but yes, we do have this available in Nigeria. I'll pass it on to Isaac to speak on Kenya.
Isaac, you're on mute.
Okay, thank you. So we do have digital health strategies in Kenya through collaboration of the Ministry of Information Technology and also Ministry of Health. Also through like such as like investments towards digital health. So we do have national strategies.
Awesome. Any more questions? You can type it out on the chat or also, maybe unmute yourselves and ask your question. Any comment from your countries? You may want to make any comparisons, any input, any questions. They're all welcome.
Hi, Pallavi, Anirudh here from
Hi.
Microsales Consulting. Hi. Thanks all you guys for these insightful presentations from Kenya and Nigeria. Some of the challenges and sort of the general lay of the land we were really aware of, but some of the insights were really helpful. For example, I could not help but notice the social health authority challenge, where it mentioned that it is one of the main drivers for increasing out-of-pocket expense, where the hospitals that are empaneled they face delays in processing payments, and that leads to people paying out of pocket because of delayed payments through insurance. So I just wanted to know if that was a similar phenomenon also observed in Nigeria as well, because I believe that was on the Kenya slides. But I really wanted to know if this was a similar situation in Nigeria as well.
All right. Yes. Thank you so much. So we do have similar challenges, like rightly mentioned. Really, there's distrust in the system because, for instance, someone within the public sector would have, paid some, or want to get all of these services, but then there's delay in just accessing this care through the health insurance. And as such, people naturally would not trust the system. But the flip side, on the private sector side, we do have very good health insurance, where in 2 minutes you can get care and services faster than the public sector. And that's one of the major areas that the National Health Insurance Authority is trying to build the trust even much more through advocacies to different people, and also strengthen the system that can fit into the content and realities of the typical Nigerians that cannot, pay for their healthcare services. So yes, there are similarities with Kenya.
Thanks, Kehinde. We have two more questions. One is from Dr. Saima, and she says that with more than 70% of population living in rural areas with lack of access to internet, how do you think digital health would be accessible and affordable to the population? And also if there is any known cause for such high MMR.
All right, thank you so much. One of the ways that from the Nigerian perspective, we see better access to internet services is making it affordable. If you look at Nigeria vis-a-vis other countries, our internet is quite affordable. I won't use the word cheap, but quite affordable. So you can use maybe less than $5 to get like 40 gig of internet for a month. In terms of the accessibility of the internet connectivity, we have very good internet penetration, even across rural communities. The challenge that we see is just adopting the tech by those in the rural communities. So yes, it's very possible that this can be accessible to people in the rural communities. Also, your question says regarding MMR, you're wondering why it's high. So it's high for certain reasons, which I think I touched a bit on my slides. The very first is that skilled care is not, we don't have the very best of skilled care because our healthcare workers are leaving. So the typical ratio of a doctor to a typical, the population should be like 1 to 500, but right now it's 1 to 50,000, if not more. And as such, we don't have those, skilled care by the healthcare workers. So that's one. Two is even the health taking behaviors. So a woman is pregnant, she's meant to go for ANCs, but she believes that going to a traditional based attendant is better for her because of what she's accustomed to in the rural communities. Even those that are even literate enough sometimes don't see the need to go for the typical ANC at the hospitals. There are delays in accessing the care from even those communities down to the facilities. So for instance, if you want to get from your house to the hospital, you have to drive long distances, and this will affect the maternal indices that we see. So that's several reasons, the myriad of issues that affect that MMR that we see. But one thing we know is if we can improve with our tech innovation, we can capture these people and we can improve these indices. Education is also very important. And so advocacy, education to them to say, we don't need to do all of these things. You can actually, with a click of a button on your smartphone, access care, and you can even live well, So those are the things that we're trying to do in Nigeria with several initiatives and interventions by government and private sector players within the space. Thank you.
Let me add to what Kende said about Nigeria. Hello.
Yeah, Abdullahi, we can hear you.
Yes, I think I said it all. We lack the workforce, like the experts in medicine, you understand. So since we lack that workforce, we have to focus on technology that we can use to spread the information, awareness, making like the people in the rural area to know what is technology, how they can learn about it and they adopt it as their way of reaching out to specialists. Because if you are to work on the workforce, it will be a long journey. But if you can work on that technology, like let's have our technology and give awareness about, because I served in the community area, they don't know anything. All they know about technology is just on Facebook and Instagram. If you can go there, give that awareness that they can use this phone to do other things. Since our data is for them, yes, they can afford data. Then I think it's something we can work on technology so that they will know what they can do with their phone. That's one thing. They don't know what they can do with their phone. All they know is that their phone can be used to be call and chat. They don't know what they can do with their phone. Thank you.
Thank you. We'll take up our last question for the session, which is by Sahil, that in case you're aware of any social and behavior change communication campaigns, that are actively being taken up on, in areas such as HIV and, other communicable and non-communicable diseases, which can help in, improving uptake and change of behaviors and change of norms. Would there be any campaigns that you guys might be aware of?
Okay, I would like to respond to that question.
Mm-hmm.
From my knowledge, I know that there are community health workers who are going into rural areas trying to educate them more on the traditional remedies. Okay, some are not good, but some are also working. For example, some of the traditional remedies actually are being used in the hospitals today. For example, I saw like wound treating. In treatment of wounds, they use honey, some of the hospitals, because that is a traditional remedy that was used before and it's working till now. So there is it is adopted into the modern medicine. And the other question. Okay, yeah, that's what I know. They go and teach the nurses mostly and the social health workers. They go and teach people in the rural areas on what to do, and also actually in delivery of children, okay, babies, delivery, yeah. So the midwives, like before the modern healthcare, there were midwives who were there helping in delivery and so on. But now, because of the modern medicine, they are trying to be incorporated into the modern medicine. They are not like entirely removed from the traditional aspect of the society. They are still working, but under supervision. Yeah, from the doctors, and yeah, they're still performing, but now under hygienic practices. Yeah, so there's a lot of, yeah, that's what I know.
And I would just like to add, Sahil, that again, Africa is one geography where it's saturated with SBCC campaigns, right? And I myself have been a part of creating some of those campaigns. So whether it was, during the time of Ebola, or, again, whether it's HIV, it's malaria, it's TB. So yeah, SBCC campaigns are one of the very usable approaches for, dispelling any kind of misinformations, helping people uptake new behaviors, change in attitude and practices of behaviors, in increasing people's knowledge. So that's definitely a driver which is used, in many aspects in healthcare in Africa. I'm not very sure if there are any specific campaigns around digital health. Maybe we'll be happy to do some more research on it. But yeah, this is something which is very much prevalent in Africa. Yep.
Yeah. Okay.
Great. Yeah.
In terms of like digital health, there is one that I know of. It's more of like a TikTok initiative. It's more of like mental health awareness. There was like a 2.3 million funding towards that was targeting Kenya, Nigeria, South Africa, and even Morocco. So yeah, that's one of the initiatives that I know of.
Awesome. I actually see a lot of conversations which have scope for, translating into further and larger discussions, because clearly, everybody has a lot to talk about, contribute. As Anuradha mentioned, that a lot of challenges that were cited today, there is a lot of scope for them to be solved, using technology. So I think we can definitely see if in the next couple of weeks we can line up a discussion 2.0 to continue, conversations around this. We also have our forum. We have a discussion forum on our website and on the app as well. So guys, please feel free to use that. You can also reach out to, other youth members through our app and through, our website. You can, become friends with them and you can chat with them. So yeah, let's keep this going. Also, we are planning to officially launch our YO.DH Africa chapter tentatively on the 28th of May. We will get back to you guys with the exact date and time by Monday for sure. So yeah, we will have a lot planned for that day as well. And it'll be great to have you folks join in. And yes, please do spread the word and help us support as we, take things forward in Africa as well. And your insights and, these kind of simulating discussions is something, which will be very helpful in actually bringing together, the world closer when it comes to digital health. And, that is one of the main aims of YO.DH as well. So once again, thank you so much for joining, guys. Really appreciate you taking out your time over the weekend. And yeah, look forward to seeing you guys very soon. Thank you. And yes, sorry. Also, we will be posting this presentation on our website. I will share the link with you guys as well as of the webinar recording. So yeah, please feel free to access it later as well. Thanks. Bye.